Welcome to the Wild Wisdom Podcast. I'm your host, Alyssa Finnick, and this is your space to learn more about the importance of slowing down, taking care of yourself, and the mind-body connection. And most importantly, how to reclaim your health by listening to your body's innate wisdom and reconnecting with the earth. Are you looking for a new way to get and stay healthy? Well, I put together a roadmap just for you, designed to help you feel good and stay sane through the integration of yoga, meditation, digestive health, whole food nutrition, and herbal medicine. It's also an overview of some of the progressive, multidimensional approaches that I've come to use with my one-on-one clients to help them connect to the body's innate wisdom in order to heal from chronic pain, exhaustion, and even trauma. So I can't wait for you to read this. So go to alyssafinnick.com now to get your hands on this 16-page guide today, or check out the show notes for the link. All right. Thank you, Melissa, for coming back onto the show. I love connecting with you.
Thank you. Thank you for having me.
Yeah. And so hopefully you listened to our last episode together about Qigong. It's a practice that I learned from Melissa, and I still do. But today we're going to talk about the effects of after having a baby and the Chinese medicine perspective. So, what happens postpartum often, and we may not even realize or correlate some of the things, but, we're really broken wide open and things are changing, physical changes, hormones, trauma can come up, that sort of stuff. So I thought we'd dive in because I know Melissa said on our last podcast, or at least when we were discussing, you were talking about that's when you see in your patients a lot of changes, or maybe like when things start getting out of balance for real. So
yes. So I also have a lot of personal experience with this. I have 4 kids that I've had at very, 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 very different times in my life. I have a 15-year-old, a 13-year-old, a 9-year-old, and a 4-year-old. So so I've done pregnancy and postpartum in lots of different ways with lots of different frameworks of understanding what the heck my body's going through. So this is one of my favorite topics. And so in general, so thinking about pregnancy, we all know, holy goodness, we are literally creating and holding a life within us. So if you think about everything your body has to do in order to do that, it's a huge energetic shift. So in Chinese medicine, all of fertility, all of pregnancy, and all of postpartum is about 2 main organ systems: the liver, gallbladder, and the kidney bladder. So the kidney bladder is our organ system that is holding our whole foundation, life force energy. So the quality and quantity of that energy is what you receive from mom and dad, and then how that was nurtured in utero. So that's another thing that I feel, and I think I might have touched on this in my last podcast, that is such an essential time. We know that anyway, but when you think of that, you're literally downloading your child with that energy, with that information during the time of pregnancy, and that influences that child's foundation. Mm-hmm. So that's one piece. The other piece is the liver gallbladder. And when you think of what liver gallbladder is from a universal perspective, from a nature perspective, it's spring. So considering that, it makes perfect sense. Of course, it's that foundation. And you take spring, which is about growing things. Mm-hmm. And it's those 2 organ systems together that are responsible for fertility, helping us to maintain pregnancy. So because of the fact that they're really, really on during pregnancy, and then once you push the baby out, mm-hmm. everything starts shifting like crazy. Mm-hmm. And so we all know this. We feel this in so many different ways. Everything that we've just come to accept as being common to postpartum is actually related to what's happening at a functional level in these 2 organs. So for instance, some mothers may develop a low-grade fever, and we can't figure out what's going on. There's no sign of infection. Mm-hmm. That's actually related to the liver energy dropping down after mm-hmm. pushing out the baby, especially if there's been a significant amount of blood loss. Okay. So another factor, like if you think about postpartum depression, mm-hmm. postpartum depression is absolutely a liver function disorder related to the fact that, again, that energy has bottomed out after you've pushed the baby out. So depending on the balance of those two organ systems before you were pregnant and during your pregnancy, it's going to influence your risk for it. Is that going to be a functional thing that shows up for you in the postpartum time?
That makes total sense, because I can tell with myself, like it's definitely liver, gallbladder, and kidney, urinary tract, like area, and like that are out of balance. And so I love like listening. I always learn when I talk to people on the podcast. I love that. And and I've told you, like, I know like this much, a small bit of Chinese medicine, just what I've learned. But so I love talking to people who are trained experts just like you, and can talk more about that, because I know that's what I've been feeling. Any more you want to share on that?
Yes.
Yeah.
Yeah. So traditionally in Asian cultures, what happens is after a woman has a baby, they're living with their family, and they call it a sitting in time, where literally they don't get off the couch. They don't get out of bed. They are attended to. They are given nourishing herbs to raise the liver energy, to raise the kidney energy. They're giving the like bone soup, all different kinds of, like there's this black chicken soup that one of my Chinese patients gave me after I had my baby. It's really gross, but the whole purpose is to raise your kidney yin.
Sure.
Because of everything that you've, literally, I mean, you've lost in in the transition of pregnancy.
Yeah.
And you're about to become a milkmaid. So
Right?
that's a whole nother energetic thing. Like, wow, I'm making food.
Yeah.
That's another demand that comes in. It includes the liver, the kidney, and the stomach energy, because the breast line is the stomach energy. So yeah, most of us aren't doing that. And the sitting in time is usually 4 to 6 weeks.
Oh yeah, you're supposed to go back to work in 6 weeks, right? According to our Western culture.
Right. And anyone who has, anything else to do at home, it's just not happening in our lives. So what happens is, because the liver and the kidney, this is a very fragile state for them during that time. And so if there's anything else that's happening in your life, the liver is our organ that helps us to handle stress. So if there's anything that's creating any extra physical or emotional stressors, if you had to have a C-section where you're cutting through those energy lines, that's a whole nother added stress. This becomes, in a way you could think of it like it's an opening time. You're very, like you said, you've been blasted wide open in every way possible. Everything is so open. So even to go back to what the traditional Chinese do, a little bit gross, but they won't even shower, because they can think that you're so open, you don't want to expose yourself to cold. Because cold energy in general is considered to be the root of anything that gets stuck in the body.
Yeah, that makes sense. Well, I didn't shower just because I was busy with the baby.
Amen.
Right? I was like, wow, you can really go so many days with not showering and you're okay.
It is a good lesson for sure.
Yes. Yeah. Well, that makes sense though. I mean, yeah, that cold energy. I mean, that's why, on a separate note, like I make sure, just knowing that much about Chinese medicine and cold energy and Ayurveda as well, I make sure my daughter doesn't get cold food when I feed her, for that very reason, to help her digestive system. So, but yeah, so this is something that, a lot of women don't realize what happens, because they aren't equipped with this Eastern philosophy about how the body shifts. And even for me, I mean, even though I've studied some things, like pregnancy and postpartum is totally different. I remember even when I found out I was pregnant, like I didn't know what herbs I could take or not take to support me. Luckily, I found Dr. Aviva Rome's book, which was helpful for me, but I didn't really understand. I had hoped for, and I should have picked your brain, I didn't even think about it, like, where's an Eastern philosophy book that talks about pregnancy and what you can do and take, because there's sometimes this fear of this or that. And I know in some Asian cultures, they might be given dong quai for blood building, and it's fine, but that might, that was cautioned against in any Western pregnancy ones that I read. So it's just sort of like, so I just didn't, of course, take those herbs, but it was confusing for me, and I wish I had had more information from the Eastern medicine side. Yeah, so that, I mean, that's a whole nother conversation, but that was interesting. But even postpartum, I know there was a recipe book for like the post 40 days. I didn't purchase that or read that, but there was an interesting one with some of those Chinese recipes and that sort of thing. Maybe I'll link to that in the show notes for everybody. You might have some recommendations too.
Well, I think, when the pandemic descended upon us, I just went crazy with my website. So my website's become a very rich resource.
Oh, good.
Okay. Basically everything I teach, I've been integrating and continually updating as things kind of come in.
Good.
So in general, as I said in the beginning, the liver and the kidney, the liver and the kidney, the liver and the kidney are the ones that we really need to focus on pre-pregnancy, during pregnancy, and postpartum. So on my website, there is a whole page on women's health, and those organs are highlighted and hyperlinked to other pages. But I also have on the main page, there's a line about organ function. I think it's organ function, emotions, and spirit. And if you click on that, it will show you all the different organs. And then when you click on each of the individual organs, there's information about how to support that organ. Like you're saying, like, what can I do from every possible angle, emotionally, energetically, with healing foods? So all of that is in there. And there is a little section just to what you were saying before about what is the physical, emotional, spiritual way to support pregnancy from this Chinese medicine angle. So I do.
Oh, great. I will link to all of that in the show notes. So everybody listening, just make sure you check the links on the website or within the apps that you're listening with, and those links will be there. Well, that's wonderful, because your knowledge, your knowledge is so vast, and I'm glad that you enhanced your website and have all of that information for everyone. I know we were talking prior to recording, about my specific issues, and I thought, if you want to use those as examples.
Sure. Yeah. Absolutely.
So we were chatting more about so when I was pregnant, I started getting restless legs. I really didn't have that prior to pregnancy. Maybe once in a blue moon, I felt a twinge, but as soon as I was pregnant, it was like restless legs. And then I managed them, I made sure I increased iron and magnesium, blah, 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 from a physical standpoint. But they were still there. And then they weren't too bad immediately postpartum, but there was just lots of stress. And then, of course, the COVID lockdown and that sort of stuff. And then my legs have been crazy restless. I do Qigong at night to make them
good for you.
To allow myself to go to sleep, because you start to go to sleep, and anybody out there who has restless legs knows this. You're like, okay, I'm gonna just snuggle in and go to sleep, and then it's suddenly like, no, you're not. Your legs are like, oh. And so so I sometimes be like, oh man, I just want to go to sleep. So I'd get up and do Qigong, even the first 3 movements and the last one sometimes.
Oh, awesome.
Just if I was really tired. Because I know you told me once, and maybe we mentioned this in the last episode, I don't know. But I remember you telling me you need energy to sleep.
Yep.
And so I tell people that all the time. You need energy to sleep. So I make sure I do that. And that really helped me go to sleep, but it hasn't solved the issue. So I'm curious to know, maybe that is an example, how, because I'm sure a lot of women have experienced that, and what that is, anything about it.
Yeah. So the liver energy, I had mentioned when we were talking about pregnancy, it's the energy of spring. It's the energy of expression. So it wants to move. And it is also, the liver is what helps us to balance our emotions. The liver is the organ system that helps us to process stress. The liver is directly connected to our ligaments and our tendons. So its energy
totally
is bound up in all of that. So given what we were talking about with pregnancy and postpartum, where the liver is going through all these shifts, so if things are even a little bit out of balance, that system may get a little stuck, a little stagnant. And then you compound it with stressors. So when you bring in the stressor, then it's even harder for the liver. It gets more stuck because it wants to move all that out. Literally, it wants to move it out. So if you're not able to get that out during the day, it uses the opportunity of nighttime to literally shake it out.
That makes sense.
Trying to shake out that, because like I said, it has to move. It has to express itself. So when you finally relax, it's like, boom, all right, let's get it out, let's shake it out. Which of course is like, okay, it's the body is really, really novel in trying to do that, but it sucks because you want to sleep. So but it's beautiful that you recognize, like, what can I do to support myself before sleep, so that's less likely to happen. And I will let you know, I mean, for those of you who are interested in the practice we keep referring to, it has just been released available for online streaming for the first time in 30 years.
Wow, that's awesome. Well, way to get with the times, Grandmaster Lou.
So we can include a link to that.
Definitely.
It's in my website too. It's all over the place.
Okay. Well, we definitely will, because I've shared it with like my uncle's best friend and everything, and who sleeps in a recliner, and like, you need to open that area up and start moving, but you might want, do some qigong. So maybe if it's online streaming, he might actually do it. So that's great.
Definitely. But then looking at, doing the energy practice is really going to help you, and especially knowing that it's happening at nighttime. So nighttime is like, nothing ever exists in isolation. So there's something happening in relationship. Again, here we go again with the kidney and the liver. Those two organs it's a parent-child relationship where the kidney is the mother of the liver. So if the liver is having a lot of intense stagnation, stress, trying to recover from pregnancy, it's going to pull on mother kidney. So you can see some things showing up in that area. So one piece of that would be symptoms that are showing up at nighttime like that. And sorry, my mind was going to something else we spoke about, because you can also see, because there's emotions associated with each of these organs, you can also see more panic, anxiety, fear-based things that start to go up that are all part of the same constellation of things. The physical and the emotional go hand in hand and together.
Yeah, well, definitely. And I mean, I know any woman, postpartum or not, I've never had a baby. I mean, hormonal stuff, you can, deal with emotional ups and downs. But especially postpartum. And I luckily didn't go through postpartum depression, but when my period returned 5 months in, because I struggled with breastfeeding. I know it was all the stress and stuff, and as well, like I realize all of that now, but I still did 6 months, which I was glad, but I really kind of was sad. I wanted to do a little longer, but anyway, now I can share with other women, and we can interview people like you, and we can share more things, and now I have more knowledge to share. But when my period returned at 5 months postpartum, after, like, so going into, escapes me, whatever phase, when afterwards, I was a crying, non-functioning mess for a few days.
Okay.
Like, I literally was like, I almost I could function and feed the baby, but like, I just couldn't do more than that. And I was like, what the hell? And it was just, a few days or whatever, maybe probably just that Saturday, Sunday on a weekend. And I almost called my mom to be like, come over and help me, please. But I made it through. And I was just like, what in the world? So it was like this little snippet of probably what some people who have, either postpartum depression or whatever going on. So found that
Right.
interesting.
Well, yeah. So, yes, definitely related. It's liver. It's liver,
Uh-huh.
liver, because not only the things that we've already spoken about with liver, but the liver is responsible for how the menstrual cycle functions.
Mm-hmm.
So what happens with the liver energy is, again, we talk about the liver wants to express itself.
Uh-huh.
So if for various different reasons it's gotten stuck, plus it is stuck when you're having a baby because that energy has to be there to grow the life. But so there's more stuck in there.
Yeah.
And then you have your first menstrual cycle and all that was stuck wants to unstick itself.
Uh-huh.
So that can show up with more significant physical things. It can show up with more significant emotional things. Again, it's that same organ system trying to release what's been stuck around the physical condition of pregnancy and anything else that kind of got stuck in that time zone.
Yeah, well,
Right.
that makes total sense because I know I had stuck liver energy anyway prior to pregnancy, so that's a whole nother conversation. But that makes total sense, and so I've been working on increasing my iron and doing some other things, but that leads me to, obviously we'll link to the website, but what are some things you could share now, like that might be helpful for, you can use me as an example, but like a postpartum woman who is dealing with something like that liver imbalance or that sort of stuff postpartum, whether it's, I'm 13 months postpartum, or
Right.
it's more recent or whenever.
Yeah. So, in general, as much as you can get creative with having support in any given way and looking at ways, as women, we all do too much. We give and give and give and give and give. And how much we have to give depends upon our own energy. That's the reservoir where the giving comes from.
Sure.
So if we're not doing things to support that reservoir, then we're going to deplete ourselves further, which just that leads to the cycle of everything getting stuck and drained and blah, 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 horrible menstrual cycles, all different kinds of symptoms that can show up to show you like, this is too much. You need to. So that's one piece of it, of really getting conscious about that. Definitely integrating any kind of energy practice that can not only help to support the restoration of the function, but can help to calm you. And there are practices that are in the website, different breathing techniques, acupressure, standing Qigong postures that are in there. And there, these kinds of things, it's in your hands. And actually, I can put in a little plug of the Indie Holistic Hub. Well-Being Fest on November 17th and 18th. I don't know which day, but I will be teaching Healing is in Your Hands, which is the 4 energy gates, which is 4 different acupressure exercises that give you a way. Like, we just want things to keep moving. In Chinese medicine, that's really the root. The heart of healing is about keeping things moving and flowing so the body can naturally heal itself. So that's one other piece. From a liver perspective, the liver wants to be creative and express itself. So really allowing yourself to see, what does that look like for you? In terms of, it could be that you need to be journaling or drawing or singing or, anything. There's no limits. Playing a musical instrument without any structure or rules about what that looks like, just allowing that energy to be engaged in a creative way that brings flow.
That's actually very interesting because knowing that, my stressors were high, I've simplified my life. And even though, I'm still a mom of a 13-month-old, and that sort of stuff and working, but I simplified my life to bring that down. But what I've shifted is making time for writing, which is one of my biggest creative outlets, and cooking, of course. But so that's very interesting. And I was talking to one of my old clients. She and I went and had dinner, and she used to paint, and she was not making time for that again. So that's interesting, that correlation there. That I find that fascinating. So.
And from an emotional perspective too, I like to think, so if the liver wants to show what's been stuck, if you are somebody who has had a lot of stuck frustration, tension, anger over a period of time, you could think of that as being like a volcano inside of you. And so you can't just do a peaceful meditation on a volcano and think it's just going to move along. It's still there. So the liver it likes to be loud. So one of the things that I teach people is, how can you move that energy? Using the voice, allowing yourself to make all different kinds of noises, to give yourself the space and time to just scream when you feel it. And maybe even times when you don't feel it, just play with it. And again, it's connected with the tendons, movement, allowing yourself to put on some crazy music and just dance it out. Were you at the class where we threw eggs at trees?
Yes. And I taught my niece that as an outlet for her anger. Yes. Yes.
Yes. So that's another thing that I teach in practice, is because when you do that, the release and just get it out there, because that's what the liver wants, is for us to move it out so we can move along. Yeah,
definitely. Well, I appreciate you sharing all about this, because it's so important. And people don't realize, like, there are, simple is probably not the best word, but there are things we can do ourselves once we recognize the imbalance. It is helpful to go, to someone like you and see as a practitioner too, so you can guide specifically. But there's just what I love sharing, and why I hope to do this podcast, is I want to share there are different ways to deal with what's going on, not just here's a pill or this or that. And there are just lots of different ways in how you eat, how you move, that big thing of, and I see in women all the time, and I'm sure you do too, and I'm guilty of this, which is why I have to always transition my life and simplify, is giving too much, doing too much. Maybe we're finding value in that, being available, that there's some self-worth stuff sometimes there. But just overexertion, giving so much of our energy away that we don't have anything left for ourselves. And it is in the energy practices, whether it was receiving energy therapy, doing energetic practices such as Qigong, yoga, of course, too, that has really helped me. And that's not something that's taught in our modern day world very often. I mean, luckily there's people like us who share that information, but it's not mainstream, I guess, is more what I'm talking about. But it's like, there's so many ways that we can help ourselves feel better, or even share with others. And the energetic movement practice, and just understanding that there's an energetic body.
Right. That connects to everything.
Exactly.
Absolutely.
Yeah, that's really. Any final things on about this that you want to share?
No, just, I really do encourage people, if you're inspired by this and you want to learn more, explore my website and really just use your intuition. There's a lot of juicy stuff in there, and everywhere you go, I think you'll find little things to guide you along the way. I guess I just want to say, sure, I'll tell you one sec. One last thing I want to reflect on that I think is really important about what I'm talking about, and everything that you're sharing too. I think with what a lot of these practices are, it isn't even that this is Chinese per se. This is really intuitive. What this practice does is it reawakens you to what you already know, but you've just forgotten or gotten stuck along the way. So it helps you to start to intuitively connect into your own wisdom. So yes, your own wild wisdom.
Right.
Yeah. So my practice website is indyhealingcenter.com. INDY.
Great. Well, thanks, Melissa. I appreciate your wisdom.
Thank you for having me.
All right. So, I want to hear from you.
What did you think of today's topic? Direct message me on Instagram or Facebook, or better yet, join the Wild Wisdom Collective, my free Facebook group, and chime in on the discussion. I look forward to hearing your thoughts and insight. And if you love what you're hearing, please take a moment to click the button on your smartphone to subscribe. Or, better yet, write a review and tell me why you love tuning in. And maybe you'll be featured in our listener spotlight on a future episode. I cannot wait to see you again, same time, same place next week. Wild blessings.